Okay, we're getting set up for YouTube. And Raymond Barteet is joining in a minute. So if we can delay the start, Jimmy, for a few minutes, we'll be live streaming, but we don't have to call the meeting to order just yet.
So you don't have call roll on that. Anything after January 4th is in your message. Uh-oh.
Chief T. Yeah.
You can get a call if you're on this thing.
Mayor Carroll,
Yes, ma'am.
we are waiting for Raymond Barteet to join. He
Okay.
is joining in now, and then we'll be ready to go. I'll let you know once he is on the call.
Thank you, ma'am.
You're welcome.
Blank. Oh. Put the mic back on.
Okay.
To join. So
Okay.
there is a lag there.
There's that dog.
Yeah, somebody rang my doorbell, so the coon hound. Sorry.
Oh, that's great.
Kimmy.
Kimmy the coon hound.
Mayor,
Yes, ma'am.
if you want, oh, he's joining in now. We can go ahead and start the meeting.
Okay. All right. Welcome. This is Owl Palm Special Emergency Virtual City Council meeting. Today is Monday, April 20th at about 1:04. I'd like to acknowledge that both the press and the public were duly notified of this meeting in accordance with the Freedom of Information Act. I'd like to call this meeting to order and have our city clerk, Nicole, call roll call, please.
Councilmember Popson,
Here.
Councilmember Streetman,
Here.
Councilmember Powell.
Here.
Councilmember Smith,
Here.
Councilmember Pound,
Here.
Councilmember Moy,
Here.
Councilmember Cannon,
Here.
Councilmember Ward,
Here.
Mayor Carroll.
Here.
We have quorum.
Lou,
Thank you very much.
good.
Okay, we have two experts today who are going to help guide us with the decisions we have to make. After each speaks, I'll go down the council alphabetically to let each person ask the expert questions. We're going to do one expert at a time. However, before we get started, I'd just like to update everyone on what the city is doing right now. The city has been on a state of emergency since March the 16th, 2020, when I signed an emergency proclamation. Our main goals are to ensure the continuity of essential and critical operations throughout the state of emergency, minimize the risk of exposure to our first responders, protect the health and safety of our public safety officers and providers of essential services, to protect and reduce the exposure of our community and mitigate the financial impact that the COVID-19 pandemic is having on our community. City Hall, the Recreation Center, and other administrative offices are closed to the public until further notice. All essential services are still available virtually by phone or by email. Please expect some delays in response as staff are working in staggered office schedules and may be working remotely. Staff is developing a staggered and measured reopening plan for council's consideration to include all city facilities, the beach, City Hall, and the Recreation Center. The Isle of Palms Police Department is fully operational, managing the access restrictions and the checkpoint at the end of Isle of Palms Connector from 7 a.m. to 7 p.m., enforcing the governor's executive orders and the city's emergency ordinances, and responding to calls for service. The city is coordinating the checkpoint operations with our neighbors at the town of Sullivan's Island on the causeway. The Isle of Palms Fire Department continues to monitor the COVID-19 pandemic. The department is fully staffed, responding to calls for service and ready to provide assistance to the community. The Public Works Department continues to provide garbage and yard debris collections services on a normal schedule. The Isle of Palms Marina and Breach Inlet boat ramp for launching and retrieving was opened at noon on Friday, April 17th. All recreational activity is prohibited with the exception of individuals having a current and valid commercial fishing license. Staff is in good spirits, aren't we? And we're taking extra safety precautions and diligently following the Centers for Disease Control and Prevention guidelines to reduce the risk of spread among employees and to maintain a healthy work environment and operations. Our first speaker today, expert, is an update from Raymond Barteet. He's with South Carolina Department of Health and Environmental Control. He's the Regional Public Health Preparedness Director. Mr. Barteet, are you there?
Yes, sir. Can you hear me okay?
Yes, sir. Thank you very much for being with us today.
No
If you
problem.
would you give us an update on where we stand Charleston County-wise with this COVID-19?
Yes, sir. I was looking at some numbers earlier today, and for a state, we currently have 4,439 cases throughout the state. In Charleston County, we're up to 391 confirmed cases. You can estimate out there are probably more individuals infected with COVID. Some preliminary estimates on that is right around 2,300 people are probably estimated to have COVID. As we look at some of the modeling data, some of this is statewide data, but some general demographic kind of information that I wanted to share is right now we're looking at about 67% recovery rate from the illness, with about 33% are still ill at this point. When we look at the age group comparison in the percent of cases, the average age is about 50 years old, with the age range for that running 2 months to 101 years old. When you look at it by gender, about 55% are female, 43% are male, with 2% being classified as unknown. When we look at hospitalizations at the time of illness or reported illness, about 77% did not require hospitalization, with 23% required hospitalization. When we look at the data further being reported by race, in general, about 50% is white Caucasian, 41% falls within the Black African American community, and then 2, 4, and 3 align with Asian, American Indian, and Alaskan Native when we look at it from that perspective. Deaths by age group, the majority of the deaths are occurring in those that are, I'm gonna look at the graph real quick, over about 61 years of age. The median or the average age of death is 75 years of age, with the median age being 75 as well. And by gender, 52% are male, 48% are female. And then by race, when we look at it, probably right at about 42% are white and 57% fall within the Black category. If y'all follow our DHEC website, we are following some modeling data from the University of Washington. And between Friday and today, there has been some changes with the modeling data. And what is accounting for some of that is they have added a couple of different social distancing categories to it. And those include the mass gathering restrictions that were put in place, as well as the initial business closure time frame. That brings it up to 6 variables that they look at when they're kind of projecting out peak hospitalization, peak days of peak death rate going on. So whereas previously our peak was being referenced around the end of April, the new modeling shows that they may have already peaked around August 15th with hospital resource use. But I would factor in that this is modeling, so there is some variability to it. And just because it's looking like we've already peaked, we may not. When we look at the containment strategies, this data is based on that after June 1st, we start relaxing the social distancing, may be possible with the appropriate containment strategies that include increased testing, contact tracing, isolation, and limiting gathering size. So from that perspective, we're not out of the woods yet. This model is based on continuing containment or social distancing measures on into May. So that could have an impact on the peak as we go further along. That's kind of what I have from a data perspective. Are there any questions, or do we want to wait on questions till the end?
Mr. Barteed, I believe that the mayor will go through each council member in order to allow for comments and questions. I think the mayor's feed dropped and he is connecting now. So I'm going to give him a few seconds to connect.
I'm back.
Okay.
Okay, sorry about that. My camera just stopped on me. Okay, Councilman Bell, do you have any questions?
Yes. So I think a lot of what we're wrestling with is the demographics of this island, and all of council was sent demographics by a resident, and I truly appreciate it. As a city whose average age, or not average, I'm sorry, median age is 56 years old, with an incredibly high population density before we have a completely open island. And the density is roughly 980 per square mile compared to 431 per square mile in Charleston County. Should we be taking added precaution given the data that you just shared about both morbidity rates, infection rates, and people greater than 50 years old, recognizing as much as it's hard for some of us sitting up here that we are actually in a high risk category. And I think when I look at these population densities and ages, that's of a fixed set of people here. So the population density only goes up with increased people. The age statistics obviously come down. But should we be taking, based on what you know, should we be taking extreme precautions or precautions beyond what the norm would be?
I think right now that the precautions that are being taken are the appropriate precautions. I do believe that additional education to those in the higher risk groups is something that needs to occur to continue for them to be safe. Does that answer your question?
Well, I think yes and no. I mean, it's a, would you have greater concern if this were an open island as it is under normal times, with frankly more people coming to the island, given it's a tourist destination? Would you have more concern? I mean, it's impossible for an island of 4,200 people to not commingle within the island, given grocery stores and other necessary activities. I think for the most part, within the current population, we've done a really good job of social distancing. The concern I have is when you introduce other factors into this population group that would appear to me to greatly increase the risk.
I would agree that if more people are coming on the island, there is the potential for negative outcomes to occur, especially if people start gathering on top of each other. So that is a risk. So I think as we look at the social distancing strategies, I feel like they need to be maintained. And I'm not, and Dr. O'Brien might be able to speak better to this, I'm not sure that we have all the needed testing for containment at this point. Now, I will say that statement really needs to come from somebody higher within my organization, but I don't believe that we're there with the testing and contact tracing that we need to have in place to support everything opening wide open. So if it's done in a strategic fashion and how that plays out, I'm not 100% sure, but I wouldn't feel like it would be good just to open the floodgates.
Thank you.
Councilmember Buchanan.
I am still taking some notes and I may have some questions in a second, Mayor.
Thank you. Thank you very much. Councilmember Moy.
Thank you, Mr. Mayor. Thank you very much, Mr. Barty. We really appreciate you being here and giving us some advice. I have a few questions. I'll try to make them brief and clear. The first question is, I'm sure along with everyone else here and probably listening, we've been looking at comparisons to the 1918 flu pandemic. And something that's been very compelling to me is the resurgence of the pandemic when social distancing measures were loosened. My question is, do you think those are fair comparisons, or are there factors from 1918 that make it significantly different that maybe we shouldn't be drawing those comparisons today? Or do you feel like that's a fair thing for us to look at to learn from history versus being doomed to repeat it?
I think it's a fair comparison, although we are probably a more mobile society than we were back in 1918. I mean, when you look at just international travel and everything and the availability and the ease of which we travel back and forth across the country. I do think some of the social distancing aspect appears to be working. And I think we're not out of the woods yet with this. I believe over the next week, as we look at some of the data coming in, we will truly know whether we have kind of hit the peak and rolled over the curve, or flattened the curve. But when we start, I think it is safe to say that once we start opening back up, we might see a bump in cases.
So your response is a great segue to my second question. Thank you. We didn't practice this or rehearse it, guys. My next question is related to when you think we will be able to start loosening restrictions, not from a timing perspective, but from a, this is what we're seeing. And I'll tell you what I heard from you, and I want to ask if there are other things. One thing is the ability to test and track and do contact tracing. That it sounds like the scaling of those efforts, and I would ask for you maybe speak specifically to what we need to see there. And then my other question, or the other thing that I heard, excuse me, is that we have confirmation that we have hit the peak and that we are on the decline. Whereas right now the data is, we're optimistic that we're past the peak, but we're not able to confirm it based on the model that we're using. So again, I'll repeat that question, which is, what do we need to see from an output perspective to say, yes, we are confident that we can start loosening the restrictions without seeing that second peak that you saw in some of the 1918 pandemic models?
I'm going to have to be completely honest with you about the testing piece of it. Testing, I am not an expert in.
Okay.
But the availability of having adequate testing available in the community, I do not feel that we have right now. When that will come, I am not sure. That being said, I can get with my epi folks on that and our lab folks and see what's happening in that realm. So I can't comment too much on that. I just know testing is not available everywhere. You know what I mean? And I believe I missed the second part of the question, the contact tracing. We do and are currently doing contact tracing on positive cases. That can be a labor intensive process, as we are doing it by telephone. So we have epi nurses, and we've expanded our capacity with nurses that traditionally work other health department services, but with some of our activities not occurring in our clinics, we brought them in to support the contact tracing. That is good, but it's also can be slow versus what you see some of the other countries doing with like tracing on mobile phones, different things like that with apps and stuff. I don't know if you will see that coming in the States or not. Not sure about that. Haven't followed that much, but right now we are limited in that we're depending on phone calls to get in touch with people. So most of the time we're not having any trouble getting in touch with them. But one of these interviews, when you're trying to talk to someone and they're trying to remember, how many people they've had contact with, who that individual was, it's a time consuming process. And so we have to really, in my mind, ramp up our resources to be ready to do that.
Okay. And so from a perspective of knowing when we're going to be able to start loosening restrictions, what do you think that we need to see? And it's not, I know that we've got this timeline of probably by June. What is it that we expect that we'll see by June so that we feel like we can loosen restrictions, I guess is another way to ask the question.
Yeah, I think we will see increased testing capacity, whether I believe that will occur. The testing is getting better. Some of the more rapid tests are coming around. And once again, this is a little out of my area. So I feel like we will increase testing capacity, which will help because we can identify people sooner. Some of the antibody testing that's currently occurring, if that indeed proves that the tests are, I guess, reliable and valid, that will help out because we'll have a shorter turnaround time on some of the rapid tests. But it's really about the availability of that and more testing being available, be it the rapid test or whatnot.
Got it.
the surveillance piece, we're continuing to do surveillance, and we have a good crew of people that is working on that. So I feel like we're making progress with that. We're continuing to onboard staff to assist with that. So I feel like we're part the way there, but I would never say we're 100% staffed up to do it. I just can't commit to that, but we are close. We have more capacity now than we had last month.
All right, and I'm sorry, I've got one final question, which is also related. In terms of starting to ease off some of the current social distancing restrictions that we have in place, specifically Isle of Palms, do you have a good idea of what order of operations you would recommend for us to start kind of easing back on restrictions? And I'll give some examples in addition to a lot of the recommendations around physical distance, masks, washing hands, etc. We've also obviously got the checkpoints on the bridges that are restricting the island right now just to folks who live and work here. We also have some restrictions on the availability of short-term rentals. And obviously, like the rest of the state, we have the restrictions on some retail places of business. If we're going to start easing back, where I think we all assume there's going to be incremental, where would you say is going to be the safest place to start that incremental rollback?
That's a good question, and I'm not sure I have a good answer for that. With the businesses on the island that are able to get up and operational, and realizing there are some restaurants and different things, there is some initial discussions about restaurants and bar type things having to change how they do operations from a social distancing perspective. You know, when we go in one now, we're all sitting beside each other. You got table after table. The restrictions on getting onto the island, to me, has a tie-in to potential spread, or somebody bringing something onto the island and then interacting with folks and maybe starting something. I'm not sure how to answer that question. I don't know.
Okay, no, I appreciate it. I understand. We're all trying to answer very difficult questions. This is all great information. Thank you. That was my last question. Thank you, Mr. Mayor. Thank you, Mr.
Thank you, sir. Councilmember Popson.
Yes, sir. Thank you, Mr. Mayor. And thank you, Mr. Barteet, for joining us today. Good insight. I have just a quick question about modeling. You had mentioned that we in Charleston County are at 391 cases, but we're projecting 2,300 by modeling. I've heard a lot of people say, you know, this modeling has never been right from whichever source. You know, when this first started, they were predicting 2.2 million deaths. Then I think they took it down to 1.4, then 500, then 100,000, 90, 80, and now I think it's 62, and they're talking about reducing it even further. So just how do we, I guess, trust this modeling? And when we talk about a peak, are we using models to figure out when the peak is going to hit?
With the peak, yes, we are using modeling to predict that. And I would say, as you see the numbers come down, a part of that is obviously deals with sample size. If we have a smaller number of individuals that are ill, and just for example, just a round number, say if we got 100 people ill and 50 of them die, obviously that's a high death rate. So as they project the modeling, it would only look worse as it goes. But as people and as countries, and us in particular, as we have implemented the social distancing piece, as we actually build more number of cases, of confirmed cases, you get a better realization of the outcomes as far as hospitalization and different things like that. So The modeling is good, and I think it shows the effects of the social distancing measures that have been put into place, in that we do have fewer cases. Now, the reported cases and the estimated cases that I referenced earlier is based on an assumption that, you know, for every one person that's COVID positive, you know, there could be 6 to 7 that we don't know about, that haven't been tested or whatnot. I can't tell you exactly where that specific number comes from, but it is based on, there is some science or methodology behind it, if that makes sense. But I think when we look at how we have limited the interactions of large groups of people, that we have seen better outcomes overall, with one, potentially less people getting ill. Obviously, if there are less people getting ill, we're going to have a lower death rate from that as it goes on through the process. So I really think the social distancing piece obviously has been the most effective thing that we can do, plus actions that individuals are taking. I know even from a public health perspective, I should wash my hands more than I do, but I've been washing my hands. I've been cleaning stuff better than what I have traditionally done. And I think as individuals, the majority of people have stepped up those kind of activities, which has helped lower the infectivity rate, which obviously has a direct impact on the death rate, if that makes sense.
Oh, is that Kevin? Are you good?
Just other one quick question, and it's about testing, and you had mentioned that, you know, maybe you weren't the testing expert, but if you use the rapid testing, whatever temperature, however they do it, one day you could be negative, but the next day then you get the virus. So how accurate is that kind of testing? And then would the antibody testing be better?
Both testing, I'm gonna say this, both testing is good. One, it determines whether or not somebody is currently ill. And if they're currently ill, we need to get them isolated and or quarantined or whatever we need to do. The second piece of the antibody testing, I think it's good to know from a perspective of who has potentially been exposed and who potentially has antibodies for COVID that helps them. So either or is good. Now, one thing to say, and you hit the point, you could test negative today and then be exposed to someone or some in the next couple of days. So, I mean, it's a point in time that you're negative. So.
Okay, fair enough. Thank you.
Thank you, Kevin. Councilmember Pounds.
Yeah, thank you, Mayor, and thank you for joining us today. Did I hear you right that we thought on the new models, the peak is April 15th?
Yes, sir.
Okay, and then I wrote down a note. I want to make sure I heard this one right too. Your comment about relaxing social distancing, your thoughts were best after June 1st. Did I write that down right?
This is based on, that is based on the modeling. And with the modeling, it specifically says that after June 1st, relaxing social distancing may be possible when containment strategies that include testing, contact tracing, isolation, limiting gathering size and stuff are in place. So there's the social distancing piece that has a direct tie-in to the containment strategies, if that makes sense.
It does. Thank you very much. I just wanted to clarify. And Randy, just one additional data point. You know, as we're looking at IOP specific densities and ages and stuff, the Wild Dunes average age is about 68. So that kind of adds into another data point. Not that that's more important or better or anything. It's just another data point to look at when we're looking at this. So, all right, Mr. Mayor, that's it.
Thank you very much. Councilmember Smith.
Hi, and thank you, Mayor. Thank you, Mr. Bartit, for joining us. You mentioned the University of Washington modeling, and that I took note of that because I just recently read an article that mentioned that that particular modeling had been criticized early on for not being accurate. Sorry, of course, my dogs are barking. And wanted to get your take on that, the accuracy of the University of Washington, whether you all are looking at any other modeling to supplement that forecast.
What I am following is the modeling that the agency has been following. They could be at our main office level. They could be looking at something different, and I can follow up on that question and let you know, because basically I'm going off of what we have publicly available. I do think some of the changes that they've incorporated into this model with gathering and the specific things of the mass gathering restrictions, factoring that in, plus factoring in business closure, as well as they are doing some tracing with cell phone tracing to show mobility of people and how mobile they are. I think the model has improved because they're looking at different parameters that weren't captured originally, if that makes sense.
Yes, thank you. And following up on that, the one expert suggests that you should hold off on making changes until you've seen a decline in cases over 14 days. How does that relate when you talk about an April 15th possible peak? Where can you give an idea of if the cases have been at all declining then? I'm sorry, go ahead.
There appears to be the start of a decline, but I would say we have to look at that decline, and this is a piece that I'm not as involved in. This falls within our epidemiology branch. The way that we're receiving sometimes positive test results and stuff from other labs, since the public health lab is not the only lab testing, obviously there are private companies that are doing it as well. Every once in a while, we'll get a dump of positive results from a lab, and it all of a sudden causes a quick spike. Well, that quick spike was because we got 3 or 4 days worth of labs one day. Now, and I would make the assumption, and I'm not sure about this, but if we take those back and actually put them on the days where they were actually confirmed, that might decrease the sharpness of a spike, if that makes sense.
It does.
But that's kind of where we're at. We have seen some decreases, but I don't think, 1 or 2 days is enough to insinuate that we're on the downhill run.
Okay. And I'm curious also about resources that the state has available for both property owners and who do short-term rentals, or hotel owners, as well as restaurant owners. Are you all offering things in addition to, I'm assuming, online? Are you doing any other, or do you have plans for things like webinars or anything like that that will help people have better guidelines for distancing, for example, like you said, within restaurants and cleaning? When can we expect that kind of thing to be available?
That's a good question, and I will take that back to our folks to discuss that. Prior to the COVID event kind of ramping up, we were doing some webinars and different things and presentations and whatnot. But I will be honest, I haven't discussed with them as we're opening up what kind of information can we be provided and guidance that would help on that. So I will forward that up.
And I just have one last question, and that is there any discussion at DHEC about recommendations to perhaps have a break in between visitors at either within a hotel room or short-term rental, a period of time to allow less likelihood that if there is the virus in that facility, that it, might become less potent in terms of spreadability.
I will have to follow up on that.
Okay.
And give y'all an answer back on that one.
All right. Thank you. I appreciate your time.
Thank you.
Thank you, Susan. Councilmember Streetman.
Thank you, Mr. Mayor, and Mr. Barteet, appreciate you being with us today. And you've already answered a lot of the questions I would have had, from other council members have presented to you. A couple of things, and it kind of relates to what Councilmember Smith just asked about the break and short-term rentals between, someone moving out of a condo or a home and then someone else coming in. But right now, in supermarkets, people are in there all the time, and of course that's being controlled to some extent in regards to the crowds. But just based on what you've seen, and and on behalf of DHEC, you think we're being effective in supermarkets and public places right now where we have a steady stream of customers?
I think there's always room for improvement with stuff. But I do think the guidelines, and whether I guess if an agency is following the guidelines that are out there or a business, and they are doing the appropriate cleaning, they are limiting the number of people into the facility, they're doing the right thing. We track down a lot of, we practice a lot of rumor control with different things when it comes to, Jobo Smith's store has 500 people in there. Well, when they don't. I do believe the measures that people are doing are effective and are being effective. I do think there's always room for improvement in anything that we do. And so when it comes to I'm going to just say the flipping of rooms, the short-term rental piece, that's a very good question. I do think there was some initial research that talks about how long the virus lived on surfaces and whatnot. So I feel like there could be some inferences drawn from that. I don't have the specifics on it, but I think that could be a good recommendation to give folks. So I am definitely going to take that up to the group, to our leadership.
Okay, thank you. Also, the modeling that you're following at DHEC, is that from the Health Metrics Evaluation Institute?
Yeah, from the University of Washington. Yep.
Right. Okay, that's the same one, and that's the model that suggested the number of potential predicted deaths down drastically from where they are.
Yeah.
I just made that as a comment. I'm not asking for you to comment on that. I think you've already kind of touched on that, but it seems like everything that I read and see these days is that no one really expects a return to normalcy anytime before mid-June to July. And I guess my question would be, based on some of the comments you made earlier, is we expect as we get more testing, there's probably going to be a spike up in cases. There will be a spike, most probably, but is the most educated thinking right now saying that we really ought to be very careful what we do all the way through the month of May?
I would say yes. I think when we need to, in general, we all need to look at this carefully. It wouldn't take but a couple of exposures to start a chain reaction of something, and we have a peak. I mean, that's the reality of any kind of infectious disease that's out there. I do hope that we are on a downward trend. I do think the social distancing measures that have been put in place they've really been our only defense against this so far, and they are working. Now, the flip side of that is this has a huge economic consequence associated with it. At some point, we are going to have to try and get back to the new normal for whatever that means with life and going forward. But I think it's too soon to say in my opinion, it's too soon to say, we're good, let's open everything up. I think that's too soon.
Okay, well then that kind of segues into my last question. I promise this will be the last. As you know, the governor will have a press conference sometime this afternoon. And there will be some restrictions that are lifted or amended in regards to the waterways, the lakes, the rivers, and our beaches. And with that, with lessening those restrictions, there's going to be, we'll be in a position where, in all likelihood, we would remove the barriers to the beach access paths here on our island. And that would open it up to our citizens on the island being able to go to the beach as they did before. Do you see any inherent dangers in that happening if and when we do that?
I don't think so if we're talking about residents of the island. Once again, the social distancing piece of it and not having 10 people on top of one blanket and hanging out together is the reality. We don't need to have that yet because we just don't know who all could potentially be infected and be asymptomatic, not showing any symptoms or anything, and there's a chance for exposure. So I do think that as we go forward, some of the social distancing pieces need to stay in effect with not having large groups of people together. I don't know if that helps or answers the question, but
that's about as good as you can do, I think. Anyway, thank you, Mr. Barty, for all the information you provided, and thank you, Mr. Mayor. That's all I have.
Thank you. Councilmember Ward.
Thank you, Mr. Mayor. I don't have any further questions this time. Mr. Moy, Mr. Popson had pretty much the same questions I had in mind. That's the way it's been all my life, being a W. A lot of people have ahead of me in alphabetical order have answered the questions that I have. So I just appreciate the seminar and everybody being here. It's been very informative.
Thank you, Jimmy. Mr. Barty, Jimmy Carroll here. Thank you very much for being with us. A couple quick questions. As you probably know, with the governor opening up the beaches, the 4 local public beaches, Isle Palms, Sullivan's Island, Folly Beach, and Edisto have put blockades at their roads, only allowing residents and those who belong on the island on Isle Palms. Do you think that is a good measure?
I think so.
Okay. The big thing that we're going to be talking about shortly, and a lot of people are watching this, are rental companies and rental property owners, is right now we are not allowing short-term rentals up until April the 30th. Should we extend that from your point of view?
I don't know if I could answer that.
Okay.
At this point until we see some more of the data coming in.
Okay. Last question, and then I'm going to ask Dr. O'Brien to see if he has any questions for you, because 2 great brains of y'all we can benefit from. The last question: how many tests are you performing daily?
Ooh, I'm going to have to get that number and get that back to you. I am not sure.
Okay. All right. So the last person to be able to speak to you will be Dr. Edward O'Brien. Dr. O'Brien, do you have anything for Mr. Barty?
Oh, no, no specific questions. I appreciate all the information. I'm happy to answer any questions from anybody.
Thank you. We're going to come to you next. Mr. Barty, thank you very much for spending this time with us, and we'll probably have to call on you again.
Okay, no problem. Thank y'all for having me.
Okay, thank you so much. Okay, we're going to have an update from Dr. Edward O'Brien, Medical University of South Carolina, Executive Director of MUSC Health Solutions, Chief Medical Officer of MUSC Business Health, Director of Business, Institutional, DTC Telehealth, and Medical Director of Physician Assistant Program. Dr. O'Brien, some comments before we start asking you questions.
No, I think everything that was said was great. I'm happy to jump right into questions. I have a couple of comments that'll probably come up during questions. So I can go
Okay.
straight into them.
Let's start with Councilmember Bell.
Yeah, welcome back, Dr. O'Brien. I think a lot of the questions we are getting are related to short-term rentals, and I don't think anything's changed in terms of concerns and our wondering about our ability to sanitize. We obviously have multiple types of short-term rentals, and I had asked administrative staff here, how many do we have? We have 1,350 business licenses and another 50 to 100. So some of these are incredibly large, some of these are very small. Do you have a perspective, if we look at the CDC guidance, the comments that we just heard about more than 10 people, and we look at this relative to our business licensing and rental laws, would you have any recommendations that, when and if we start to change the allowance of short-term rentals, that we also take into account the size of the rentals and the amount of people that are allowed into them, because there's some immediacy that we violate not only the state guidelines, but the federal guidelines that are being put out by CDC. Any thoughts on that?
Oh, no, right. I think that's accurate. I mean, I think you want to stay within those 10-person guidelines if at all possible. The trick will be, some people may say, oh, this is 10 people. This is my family who I've been quarantined with the whole time. That'd be difficult, I think, to ascertain. However, all the houses I've been around hold way more than 10 people.
Yes.
So I know there's some very large places. So it would prevent a very big challenge, right? If you have diverse groups within one household where the transmission of virus is potentially the highest.
Thank you. I'll defer to the next. I get to go first generally in alphabetical order. So
Thanks, Randy. Councilmember Buchanan.
Thanks, Mayor. And thanks, Dr. Bryan, for joining us again. We had Mr. Barti talk about the peak of this virus being sometime 5 days ago and slowly starting to decline now. And if that's the case, 14 days following that peak would be about the end of this month. Do you see where the city should extend its continue to extend its restrictions, or do you think at that time we'd have the ability to start lessening the restrictions and opening more things up?
Yeah, and I think what's happening right now with you guys potentially wanting to open the beach accesses up to residents, appears to be a lessening of restrictions, which is probably a good thing. And I think in a very well thought out, logical, stepwise approach of gradually opening or lessening restrictions is a good idea. What's most interesting that I heard people talking about the modeling, that Washington modeling and things like that. There's two things I just want to point out about the modeling. The first thing is that it's statewide modeling. So it takes high areas like Kershaw County, for example, everybody knows is very high, and it also factors in very, very, very low places. We don't know if the very low places are because we're just not testing enough or because, actually the incidence is low. What it doesn't factor in is what happens when you allow tens of thousands of tourists back into your city. So the model does not factor that in. So, everybody's like, oh, the model was wrong because it factored everything down. But actually that just shows that our methods for controlling the virus have been very successful. So what you don't want to do, and I think this is what Mr. Barr was getting at as well, is that you don't want to open things up too quickly because the exact opposite will happen. Then that number will flip back up, your peak will look further down, and your death and infection rate will go up. So I think you're right, a slow opening certainly seems reasonable over a prolonged period of time.
Okay, thank you.
Thank you, Ryan. Councilmember Moy.
Yeah, thank you, Mr. Mayor. Thank you, Dr. O'Brien. I'm going to ask sort of some of the same questions I asked to Dr. I said Mr. Barti, excuse me. But I do want to start with digging into the short-term rentals, because I know that's obviously that's a really big important factor for the island from an economic standpoint. And A lot of folks who live out here, their livelihood is based upon that. A lot of the folks who own homes out here, they're reliant upon that. So that is obviously very important to us, as is opening up the checkpoints and opening the island back up to our neighbors. Those are, probably the two biggest things that we're hearing. They all are secondary to making sure that we protect public health and keep our community safe. But those are kind of the two big things hanging out there. So as it relates to short-term rentals, I think the discussion is really, I think, positive in terms of how do we take incremental steps towards starting to ease those restrictions, because no one's arguing for just flip the switch and open everything back up. And so I'm going to ask you for what are other incremental things we can do. One is limiting the number of people that can go into a rental. So let's say we follow the CDC guidelines and say less than 10 people. The other thing that I think is fairly obvious is restricting access from people who are coming from hotspots. And we have good data nationally to know where those areas are. I think my questions are, first, thinking through what are the incremental steps that we should be taking to when we decide, or when the data tells us it's probably safe to start opening things up. Where are the places where you would recommend that we start, and the restrictions that you would recommend kind of keeping in place a little bit longer versus the ones that maybe we can be lax on? Did my question make any sense? I know I rambled a little bit.
No, that's good. I think Mr. Bartee had a good point where he said there's two things to look out for. There's the amount of testing we can do locally, and then there's the contact tracing. So I think this is on your first question too, is that when you said, is it more dangerous to have, people from out of town or out of area renting? The answer is yes, that is more dangerous, because we may not have contact tracing on those people. So DHEC, for example, is doing a great job. They're working their tails off, I know, trying to contact trace within South Carolina, and South Carolina is their responsibility, right? But New York City is not. So, you have people come in who maybe have the illness, spread it to other people here, and then we're only contact tracing those people here. We don't have a national contact tracing system. So certainly bringing in outside people will increase the risk of spread of the disease. And I know that is most common with short-term rental properties. So I agree with you. Some things, I don't know how to the logistics behind any of this, but certainly if you could limit the amount, the size of the rental, the number of people, the locations people are coming from, although asymptomatic people can get it, and you could obviously get it on an airplane getting down here, but that's a possibility. Maybe even allow the rentals only for in-state residents to start with, because we have data on our own state, right? We can contact trace our own state, and that's kind of our responsibility, but not necessarily other states. So that might be a potential. And I think South Carolina that'd be a way to do it so that people in South Carolina might be happy with. There's some ideas that I think are all good ideas.
Mm-hmm. Okay. I think if I can make a comment to the rest of council coming out of that question, I think, Dr. O'Brien mentioned the difficulty in some of the logistics. I would say that that's something that we could work closely with rental agencies as government and the key stakeholders in this decision to say, we want to start opening things back up. We want to do so safely. We've gotten some recommendations on how to do that, but we need your help on how to implement it. So we're not speaking about timing on that specifically. We're just thinking of when the time comes, whether that's 2 weeks from now or a month from now or whatever, that it's incremental. And I think that's what all of this discussion is around. How do we take incremental steps so that we avoid creating another peak? Thank you again, Dr. O'Brien. My other question is related to some things that I've been digging into a bit are, it seems like there's a lot that's still unknown about this virus in terms of the long-term impact. And there's been a huge focus on the mortality rate. And so a lot of the discussion publicly has been around, well, the mortality rate, especially for people under 50, is pretty low. So, we should get things back going. But even for folks who have a low mortality rate, what do we know about the long-term impacts? Because from what I've seen, there's a lot of this disease is more neurological in nature than some of the typical flu. And that's why you see people losing their sense of smell and sense of taste. And And frankly, I'm concerned for myself. I don't want to catch this disease because while I have a high likelihood of survival because of my age, I don't know what it's going to do to me. So but I'm not a medical expert, which is why I'm asking you, what is the medical community discussing and saying about the way this disease may have an impact on people for years to come?
Sure. Yeah, I think you're right. We don't know a ton of long-term things. We don't know if people will develop, people who have bad lung issues with it, right, who maybe don't end up on a ventilator but have to go to the hospital. What will happen to them? Are they going to end up with reactive airway disease or some sort of inflammatory condition in their lung or their pulmonary function, their lung function going to decrease somewhat, decrease cardiopulmonary potential activity? How does it affect people's hearts, which we're seeing some affect people's hearts some. The smell stuff is more interesting. We don't know a lot of that kind of stuff. I'll say a 20% hospitalization rate is incredibly high for a viral infection. That the majority of the symptoms mimic the flu. So what's interesting is that the mortality rate we do focus on, but really I think the hospitalization rate is a better thing to look at because those are people who are very, very, very sick and can't be members of obviously society for a prolonged period of time and could have complications down the road.
Yeah. Okay. Thank you.
Thank you, John. Councilmember Popson.
Yes, sir, Mr. Mayor, thank you. And Dr. O'Brien, this is your third time with us, so we really appreciate your time and help. I'm going to try to bore you with a little bit of data. We receive a update each day, and one of the attachments is a map. It's the cases reflects the cases reported within the last few days or 2 days or whatever. And I've been tracking this ever since we've been getting these. And recently, in the areas I've been tracking is Charleston County, Mount Pleasant, Sullivan's Island, Isle of Palms, and Kiowa and Hilton Head. And I'll share why Kiowa and Hilton Head. But Charleston County's high was 269 on this report in April 6th. We are now down as of yesterday to a low of 117. That's 12 days. Mount Pleasant's high was at 72 on April 4th. Now they're down to a low of 21, which is 14 days. Isle of Palms, as we all know, was 0 for a little while, then 1, and then up to 4. It's back down to 3. Sullivan's Island was, the high was 6 on 4/2, and the low is 1 as of yesterday, 16 days. Kiowa, his high was 12 on 4/2, low was 2 cases in 4/18, which is 16 days. And on Hilton Head, the high was 8, the low was 4. The high was on 4/8, the low was yesterday, 10 days. And the reason why I'm bringing up Kiowa and Hilton Head is I spent a lot of time in Kiowa the last month and a half, and it's crazy the amount of cars from New York, Connecticut, and New Jersey. I've been to Hilton Head twice in the Bluffton area. Same thing there. It's overrun with Connecticut, New Jersey. So the hotspot areas are coming in, but those areas numbers are going down or weren't really high at one time. So I guess my question is, I know this is a small sampling, but it seems like it's trending in the right way. Do you have any opinion at all, or is it too early to give an opinion of us thinking about reopening some things based on the diminishing returns of these cases?
Yeah, I think that's a good thing that the cases volumes are going down. Also people are getting better. The majority of people are improving from the disease. Obviously, I think we have something like a 60-something% improvement rate that we can document currently. So that's all good news. I don't, the issue is, I don't know anecdotally, with the license plates, how long people have been down here and all that kind of stuff. I don't know. But, and also I know a lot of rental car companies have those license plates. I can't say, I don't know anything about that, but yeah, I mean, the evidence certainly points positively, right? So when I was first on this call a while ago, we didn't know, we were talking about, are we going to have to be closed through the summer and all this kind of stuff? It certainly does not appear that that's the case anymore, which is why now we're talking about a gradual reopening. So I think certainly along that way. I believe Kiowa, I could be wrong, is reopening their short-term rentals. I believe maybe halfway through May. I can't remember exactly, but I know they're certainly supposed to be open by June. But that's all I know about that. What you don't want is a case like made the news in Jacksonville, where they open their beaches and they're overrun, apparently, with people all on top of each other. Now, I don't know if that's just the pictures or what. I obviously wasn't there, but that's what you don't want. And you want to make sure you're able to police the groups of people where it's not too large of groups. But yeah, I think gradual reopening is certainly a good and reasonable thing.
And one other quick question, Mr. Mayor and Dr. O'Brien. Outdoor businesses, the governor's pulled back on the boat ramp, the beaches. So a lot of the outside activities going on. Is any kind of outdoor business, like we have a marina, in your opinion, is that something we can start thinking about reopening? And if not, when?
I would think this now, nobody wants to commit on anything with this virus, right? Everybody said, well, we don't have the data on how coronavirus behaves outside. But I think I see what you're getting at, and I do think we can use common sense. So certainly outdoors, in open air, if you were to cough or sneeze, the respiratory particles probably won't hold in the air as long because there's turbulent airflow and other things, right? We have a little bit of data that just came out that I saw, I think it's from the National Health Service, that showed high heat, high humidity, and sunlight do decrease the amount of time this virus lives on surfaces. So that's good. If I were opening things slowly, I certainly would think outdoor activities where social distancing can be practiced easier, right? Like in boat ramps and things like that. I think those would be some of the first things to open. I agree.
Fair enough. Thank you so much.
Thank you, Kevin. Councilmember Pounds.
Yeah. Hey, Dr. O'Brien, thank you for joining us again. So could you just give a quick comment? Last time we were together, we were looking at the peak being the end of the month, but the DHEC, and I'm assuming you guys use the same models, we may have already passed it. Do you have thoughts or comments on that?
So we have our own models, and they can be found on MUSC's website. And Dr. Michael Sweat and our epidemiology team has made our own models. They don't necessarily agree with the Washington models. We're not sure. We think the peak might be, this week. But they're not necessarily in 100% agreement because we're trying to have truly localized models. They're not that far off. It's a matter of 10 days, something like that difference.
Yep.
But I do think the models, to some degree, there's some conspiracy theory out there saying the models were never accurate and they did have social distancing factored in, but the truth is it's never been done before like this. So there's going to be a margin of error.
Yes, there are a lot of conspiracy theories for sure. Yeah.
There are. I'm not much of a theorist, but I think the models are just reacting to the successes we've had with social distancing.
No, and I would totally agree with that. And I know DHEC wouldn't comment on the testing. Do you have a view on states' preparedness or even our county area preparedness around testing?
I can say that, obviously MUSC is doing the majority of testing in our Tri-County area, far and away, and we are ramping up capacity to a very, very large degree. We're able to do, where we were only able to do hundreds, we're about to be able to do thousands of tests. I would think by May. We're also heavily into the antibody testing world now. We're both getting antibody tests available and developing our own antibody test. So within the next month or so, we'll greatly increase the amount of testing. We're also working on some technology to help with contact tracing. So this will be increasing quite a bit.
All right, great. Thank you, Dr. O'Brien. Good, Mayor.
Thank you. Councilmember Smith.
Hi, Dr. O'Brien. Thanks again. You've been wonderful to keep coming back to our meetings. I'm just going to quickly ask and revisit an area we have talked about before, which is short-term rentals and having a break between different groups or between hotel stays, and the actual amount of time where that spacing produces a positive benefit in terms of reducing the potential spread for the virus. Can we return back to that? And can you say, like for every hour or so that of space before a set of cleaners gets in there to clean is beneficial, or do we have to talk more about of at least a day, 24-hour period or longer before we see decreased risk?
Well, the virus, the active virus, I would call it the live virus that can infect you. So it's interesting. So when you look at some of this data, they're swabbing things, like they're going into rooms and swabbing areas, and they're seeing that there's virus particles there. Well, that doesn't necessarily mean that you can be infected by those virus particles. It just means that's where the particles are. So we don't have great data on how long they're kind of alive. We have great data on flu. You know, oh, it lives on, you know, it doesn't live on copper very well, but it lives on plastic for 6 hours, blah, blah, blah. That's not the actual data. I'm just making that up, by the way. But we don't quite have that data on COVID yet. However, the longer it's exposed to the environment, the worse it is for the survival of the virus. And certainly there is some good data on showing that it can live on certain substances for 24 hours or less. So certainly extending the timeline. But with the cleaning crew, I would just think having them proper protective equipment as they clean and making sure they clean with the right substances between visitors is ideal.
So that you wouldn't be as concerned if they were suited up properly about allowing for a gap between renters or visitors?
Correct. Yeah, I would think the increased danger would be, you know, the next group of renters that come in if someone was positive. That would be the more increased risk, because the cleaning crew have a relatively limited exposure, and if they have proper protective equipment, I wouldn't be quite as worried about their risk.
But the proper protective equipment, is that kind of equipment readily available to the degree? I think you indicated previously that you would, you know, more concerned about the potential for exposure to somebody who is cleaning, and especially without direct, strong supervision to make sure that they were, you know, following correct practices.
Yes, I mean, in an ideal world, I think you would train them in correct practices, and then there would be enough protective equipment. I don't know the amount of protective equipment that's available. I know it's tough to get even in the hospitals, so I would imagine it's even more challenging to get with the cleaning crew.
And so just a regular face mask that I could buy at the store versus, would that be enough? Or when you talk about protective equipment, are you talking about something more hospital grade?
Well, typically the hospital grade stuff you only need if you're directly exposed to aerosolizing things. So I don't know everything the cleaning crew does. I don't think there's any evidence showing that if you're bleaching a surface, you know, and wiping it down, that is a high risk exposure. I don't think it is.
Okay.
But I don't know the answer on vacuuming, for example. I wouldn't be able to say. I don't think anybody knows that answer. But yes, I would think any kind of facial protection, gloves, you know, and using the proper cleaners makes the most sense.
Okay. And what about potential for the virus to live on fabrics?
I don't have any data on that yet. Sorry.
Okay. All right. Thank you. That would be all for me, unless you have any. MUSC is perhaps coming up with any guidelines for people in the tourism industry to move forward with. Do you know of anything like that?
Yes, we are actually. We are coming up with some guidelines, and we're not quite ready for prime time on those, but it's basically a special kind of consultation that we can do industry to industry to really put our best minds on it.
Awesome. So what if perhaps the city organized a forum by webinar for its industry, you know, leaders or really to any business owners? Was that something that we could engage MUSC in helping us with?
Oh, definitely. Definitely.
Super. All right. That's all for me.
Okay, thank you, Susan. Councilmember Streetman.
Thank you, Mr. Mayor. And Dr. O'Brien, thank you for being with us again. You've been a wealth of information for us. We really appreciate it. I just have a couple of things here. With the virus, have we seen cases where someone has the virus and then then they recover and then get the virus again? Have we seen repeat instances of infection?
We have not. I will say there's some data out of South Korea, I'm sure you've probably seen, where they said of the thousands and thousands, they tested 100 and something people tested positive, and they called it again, but it was something like 14 to 20 days afterwards. We don't know. We think more likely than not, since those people didn't need to go to the hospital or anything else, that they were just shedding virus for a prolonged period of time, as opposed to getting reinfected.
Right. Okay. And also, as I understand it, the virus will tend to go away during the hot, humid weather. So during the summer, and with good social distancing, that sort of thing continuing, we'll see probably a lot less cases. We certainly hope so. But in terms of when it sort of disappears for a while, there's also a greater possibility that it could emerge again during the fall and winter. Is that correct?
I think, traditional viruses, you're right, do disappear more in the summer. And that probably is at least partially a condition of social distancing. For example, kids aren't in school and things like that. And viruses don't like the hot, humid weather. You're right. We don't have good data on that yet, but we are thinking that there is a potential for a rebound of this virus as the weather gets cooler or comes back around. You're correct as well.
Okay. And last thing, I'm sure you're familiar with the CDC/White House guidelines that have come out on opening up America again. Have you had a chance to look at that, and what are your thoughts in regards to that?
Yes, I've had a chance to look at those. I believe there's, I don't know, I've got the CDC ones here somewhere. There are about 10 pretty good points on there. I think the CDC points are all well taken, and I think they basically keep in effect the majority of the social distancing and cleaning and all that kind of stuff. And it doesn't make comments on wearing masks in public and some other things that I kind of wish it had. It's broad, I'll say that. I'd say for our particular businesses and industries that you would want more direct public health and or medical walkthrough with our particular challenges. And that's something MSD obviously can provide, but I would like for it to be a little more detailed.
Okay. Well, thank you, sir. We appreciate it. Mayor, that's all I have.
Thank you, Rusty. Councilman Ward.
Yes, sir. Thank you, Mr. Mayor. And thank you, Dr. O'Brien, for joining us again. It seems like to me from your answers and comments and things that we're in hopefully a better place than we were this time last week. And I was just wondering, I'm hoping that council will continue to have this meeting at least once a week. If you'd be available to join us, if council agrees to meet again next Monday, would you be available to join us to update us and give us a progress report? Hopefully it'll continue to be positive news.
Sure, that should be.
That's good. I think the council members have asked a lot of really good questions, a lot of questions that I have. And so that's all I have, Mr. Mayor. Thank you.
Thank you. Thank you, Jimmy. Dr. O'Brien, we're here today. And number one, I can't thank you enough for being with us 3 times in a row now, and also having to listen to us before with Mr. Bartit. But again, it's great information. We have in front of us the possibility of extending or not extending our rental short terms. Right now, they're prohibited up until April the 30th. From your professional point of view, should we extend that further out, or should we stick with the April 30th?
That's a challenge. I'll have to, I know.
I'm sorry.
Mr. Barty kind of said the same thing. I will say that if you feel like, I'll say this. Okay, so say you're going to open the beaches up to your own residents tomorrow or this week or whenever. So that's one thing. And then how long does it take to when you figure out whether that's been successful? So say that takes a week. then you open it up to all South Carolina residents and open the beaches up publicly to South Carolina residents. I'm just making this up, obviously, not your plan. But then it's going to take a couple more weeks to figure out if that was successful or not. Can you police it? Can you, how can you really keep the groups away from each other? That kind of stuff. I would think opening up short-term rentals in that same time period would be a challenge. I would think you would need a week or two between each incremental step to make logical decisions on whether you've been successful or not. That being said, I would think mid-May would be the earliest I would personally consider that, just because I just don't see how you're going to be able to open it all up within a couple weeks and get logical, kind of results. That would be what I would think. But
Listen, thank you very much for that. I have no other questions. I'll quickly go down the list just to make sure nobody else has anything. Chief Cornett, do you have any questions?
I do not. Thank you.
Okay, Councilman Bell?
Nothing further, Mayor.
Councilman Buchanan?
I have one question. Thank you. And thank you again, Dr. O'Brien. As for the beaches, as you know, the governor has lifted the restrictions on boat ramps and allowing people to get in the waterways, but he had mandated that all boats need to be moving. You cannot anchor, you cannot set unless you are actively fishing. Boats are limited to 2 people, and if it's more than 2 people, they have to be of the same family. If we were to go through and when the governor lifts restrictions on the beaches, and the beaches are open to residents, and the beaches are open to South Carolina residents is what he's doing. Would you think something like that would help to allow people to keep moving, or so that people aren't gathering in one spot? My question is trying to appease some of the folks throughout the county as well who want to get over here and utilize the beaches. Would that help if we were to able to go through and make sure that those people kept on moving, or do you think that would not have an impact on it?
I think that's a great idea. I'm one of those county people who wants to use the beach. But yeah, I agree. And I think I'd have to defer to the police force, but it seems to me like that would be easier to enforce if you have rules like that in place. So you know who's trying to congregate and who's not. I think that's a great idea.
And one of the reasons we shut down the beaches in the first place was the fact that it was kind of the trifecta, a perfect storm, where we had all the restaurants shutting down, all the schools getting shutting down, all that was in spring break, obviously. And then we have all these folks coming to the beach, and we did not have the manpower at the time, and everybody was kind of taken by surprise. Charleston County didn't have the help, the personnel to help. The DNR didn't have the personnel to help. And SLED didn't have the personnel to help, because it was everybody, all the coastal communities were inundated at one time. And it took us a little while to recover from that. I know Charleston County and the sheriff has reached out and said that they would do whatever they can to help try to get to patrol those areas so we can, continue to monitor our island. But that was the biggest thing. If we were opening up to, outside of Olive Palms as well, would mandating that motion be a part of that mandate would help out? That's the only question.
Yes, I think that definitely should be a part of that. You have to assume you have incredible pent up demand, both for your short-term rentals and for your beach accesses. And however many people you think are going to show up, it's going to be a lot more, just like you saw in Florida. And
right.
So
Right.
I think you're 100% right. They're very wise.
Okay.
Thank you, Ryan. Councilmember Moy, any more questions?
No, I'm glad that Councilmember Buchanan brought that up, and I'm going to react to it, because I found that policy very appealing, and I think it's a good incremental approach for us to consider. I would say that Jacksonville did have that same policy in order, so it was a motion policy, and from what I can tell, and again, obviously I wasn't there, so I'm relying on what's being reported, but it looks like the ordinance was by and large ignored by a lot of people, and that was the problem. And that's the phrase, we can't have nice things. There's always a few people who are going to ruin it for the rest of us. So I would say I would like to see us go in that direction as my first response and reaction. I think Councilmember Buchanan nailed it, putting having the beaches open to those who are in motion is a great way to ensure it's something that seems to me enforceable. Of course, I'll look to the chief and the rest of public safety, but it seems more enforceable to say no coolers, no chairs, no towels, no umbrellas, only if you're there in motion. It seems enforceable. And yet I don't think that our staff has the personnel right now to be able to do it. And so I do think we will be dependent on the county and the surrounding communities to help us enforce those policies, since really we'll be enforcing it in large part due to the influx of folks from around the area. And so I know we'll have to look to the administrator for Goso and Chief Cornett to figure out what personnel additions will we need and how do we go about getting that from the rest of the county to support us.
Thank you, John. Councilmember Popson.
Good, thank you.
No more? Yes?
I'm good. No more
Okay.
questions.
Councilmember Pounds.
Nothing additional, Mayor. Thank you.
Thank you. Councilmember Smith.
I don't have any additional questions. I could go ahead and chime in terms of what Councilmember Moy was saying, although I think it might be good for one of our baby steps to be that we pull back the hours of restricted access more to like 8 a.m. to 6 p.m. to allow a little bit more opportunity for our neighbors to come. I think that one thing we need to remind everybody of is that our neighbors can come and access the beach before 7 o'clock, or well, once the governor changes his orders, if we revert back to what we had before, people could come to the beach between 7 a.m. and 7 p.m. So they did have an opportunity to access the beach. We never totally shut it down until the governor shut it down to most people. So I think that there's some different options we could have for incremental easing of restrictions. That's all I have. Thank you.
Thank you very much. Councilmember Streetman.
Thank you, Mr. Mayor. No further questions, but I do want to thank again Dr. O'Brien for joining us. Thank you very much.
Thank you, sir. Councilmember Ward.
I did have a comment, though. I think it'd be interesting to follow the data in Jacksonville, especially like 2 weeks from this past Friday. You know, Jacksonville is in Duval County, but just south of there is St. John's. And I know early on, St. John's County had full restrictions on. Not sure if they did this past Friday and going forward. But if they did, it might be an interesting data research point to see what happened between the differences or the variances between those two counties immediately down the road. It's something I'm going to look into for next week. But thank you, Dr. O'Brien.
Thank you, Jimmy. Chief Graham, do you have any questions for Dr. O'Brien?
I have no questions, but I do appreciate what y'all are doing, not only for the residents, but also all the employees. Thank you.
Thank you. Dr. Bryan, I cannot thank you enough. And yes, we would like to call on you again. We need your expert medical advice and the decisions that we make. So thank you very much again for joining us today.
No problem. Thank you.
Thank you. Okay, we're moving on. Consideration of amendments to the emergency ordinance 2020-02 to implement further measures to protect the citizens of the Isle of Palms, including but not limited to extending the access restrictions and the prohibition of future check-ins for short-term rentals, hotels, and other accommodations, and other measures proposed for the safety and the public health of the city of Isle of Palms. Do I hear a motion?
Mayor, I'll speak up first.
Yeah.
I have given our administrator a call. I personally think it's appropriate that we go to executive session and return and have this discussion, because my concern all along in general on short-term rentals is enforceability and our ability to really affect anything. And as one, I would appreciate having that conversation, coming back and then having a further conversation around whether we intend to keep in place or amend the ordinance.
Okay, good point, Randy. We have on our agenda executive sessions, but it's for a different matter totally. Desiree, point of order?
Sure. City Council can receive legal advice on any item on the agenda. It just requires a motion to go into executive session, and we can spell out the section of the Freedom of Information Act that we would be using. And we have the city attorney participating. So if there's any particular question you all need legal advice on, we can certainly do that.
Okay, in accordance with section 30-40-70A2 of the Freedom of Information Act, to receive legal advice about a potential claim related to the violation of the emergency ordinance 2020-02. And I think Councilman Bell would like to add on to that advice about short-term rentals.
Yes, if I need to add on to that, but I would make that motion.
So we have a motion to go into executive session. Do I hear a second?
I'll second it. Ms. Phil.
All those in favor say aye.
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 Ladies and gentlemen out there watching us, we are going to go into executive session, maybe 30 minutes, and then we'll come back. But we will make no decisions while we're in executive session.
Mayor,
Yes,
if we can have the city clerk do a roll call for the vote to go into executive session so that we can have the correct ones on the record.
Absolutely.
Thank you. Councilmember Popson,
Aye.
Councilmember Streetman,
Aye.
Councilmember Bell,
Aye.
Councilmember Moy,
Aye.
Councilmember Ward,
Aye.
Councilmember Pounds,
Aye.
Councilmember Buchanan,
Aye.
Councilmember Smith,
Aye.
Mayor Carroll,
Aye.
all in favor?
Aye.
Off record at 2:32.
Okay, so
Mayor, just for the viewers, we will stop the live streaming now and then return to the live streaming once council is ready to come out of executive session.
thank you. Thank you all.